Hello, everyone. My name is Yael Rachamin. I'm a research associate at the Institute of Primary Care at the University of Zurich, and I'm very happy to present today the results from our observational study on the impact of the COVID-19 pandemic on the intensity of health services use in Swiss general practice. This study was conducted in collaboration with researchers from the University of Bern, the University of Geneva, and the University of Fribourg, and was partly funded by the Swiss National Science Foundation. We are currently working on a mixed methods research project investigating the impact of the pandemic on the continuity of care of patients at high risk of severe COVID. The first part, which I will present today, was a quantitative analysis focusing on the first COVID wave in Switzerland in spring 2020. The second part, which is still ongoing, is basically a repetition of the quantitative analysis, but for the whole year 2020, with the integration of qualitative findings, namely patient and GP experiences and perspectives on continuity of care during the pandemic. The preliminary results of the qualitative analysis are presented separately by Michael Demmel, also in the session today. So with the first study, which was published in the International Journal of Public Health, we aimed to explore the impact of the first wave of the COVID pandemic on the intensity of healthcare use in Swiss general practice. Healthcare intensity was operationalized by consultation and chronic disease measurement counts, namely blood pressure and glycated hemoglobin, which are typically measured in patients with hypertension and diabetes, respectively, and can therefore give an approximation of regular routine care in general practice. So basically, we predicted weekly consultation and measurement counts in the first half of the year 2020 that would be expected in the absence of a pandemic. And then we compared these predicted counts to actually observed counts. For this analysis, we used data from a primary care database called FIRE, which contains anonymized electronic medical records data of over 700 GPs, or general practitioners. These general practitioners are distributed all over the Swiss German-speaking part of Switzerland, as you can see on the figure. The predictions were done using linear regression models, both for the total general practice population, as well as for different at-risk groups, namely patients with hypertension, diabetes, cardiovascular disease, and different age groups. So, patients who were at high risk for severe COVID. Before going into the results, it is relevant to mention that there was no distinct lockdown period in Switzerland in spring 2020, but rather a stay-at-home recommendation coupled with the closure of non-essential businesses and schools. We refer to this period as shutdown period, and it is shown here in orange. So these are the consultation counts of general practice patients during the first half year of 2020, from January to June. In gray, you have the predicted counts that would be expected in the absence of a pandemic. Also for these, you can see temporary decreases, which are due to public holidays such as Easter. So these are not pandemic related. But in blue, you have the actual observed counts in 2020, which were lower than expected during the shutdown period, but quickly normalized after the relief of the measures here in mid-May. And quantifying this decrease here during the shutdown period revealed that it was around 17%, both for the total general practice population as well as for different risk groups, so patients with hypertension, diabetes, etc. Of note, the consultation counts included both virtual and face-to-face consultations, because these could not be discriminated in our data. Therefore, it is not surprising that when we repeated this analysis for the chronic disease measurement counts, namely blood pressure and HbA1c, we observed an almost twice as high decrease of around 30 to 35%, because these measurements typically require an in-person visit. So it seems like the drop in in-person visits was much higher than these consultation counts here suggest. So in conclusion, we observed a significant decrease in health services intensity during the first COVID wave in Switzerland. But the decline was moderate and quickly normalized after the shutdown. With that, I would like to thank you very much for your attention, and I wish you a nice rest of the conference.